Despite a 30% reduction nationwide in opioid prescriptions from 2013 to 2018, prescription opioid overprescribing, as well as opioid misuse and overdose, remain significant U.S. public health issues. To address a deficit in educational resources for clinical providers and their patients, the University of Michigan Injury Prevention Center, in partnership with the Michigan Department of Health and Human Services, created the Michigan Safer Opioid Prescribing Toolkit, one of the first fully online, comprehensive, evidence-based clinical resources to address the opioid epidemic. To ensure we created the best possible resources for providers and their patients, we conducted a needs assessment among primary care providers across Michigan and a comprehensive review of publicly available resources on opioid prescribing. Find the toolkit online at mishmed.com/OP Toolkit. When you land on the toolkit homepage, you'll see resources curated across 8 domains. If you hover your cursor over a section's icon, a brief description of what you can find in that section will appear. Let's say we want to see the resources on safe storage and disposal of opioids. Click on the link from the homepage and you'll be taken to another page where you can choose to view either provider or patient and family-focused resources. Again, hovering over the icon will show you a preview of the resources in that section. You can also use the menu at the top of each page to navigate directly to a provider or patient page. On each page, you'll find a collection of resources that we have identified or created. At the bottom of each page, you can quickly link to the companion patient and family resource page for that topic. Navigate to the Handouts tab to quickly access the handouts that we have developed. Use the clinical decision flowchart to guide your assessment for treating patients with chronic pain. You can conveniently link directly to assessment tools like the Opioid Risk Tool directly from this flowchart. Download and print the Words Matter handout to post in your clinic. Or download one of 4 handouts on safe storage and disposal to share with your patients. The newest section of the toolkit features resources on post-overdose care in the emergency department and features drafted protocols on take-home naloxone and medication-assisted treatment that you can download and adapt for use in your emergency department. The toolkit contains over 400 provider and patient-focused resources on opioids, and we are continually updating it with the newest, most up-to-date information for you and your practice. Scroll to the end of any page in the toolkit to sign up for our listserv to be notified when new resources are added. If you have resources you think would make a good addition to the toolkit, or for any other inquiries, contact us at uminjurycenter@umich.edu.